The prominence of the opioid crisis has brought mental health and addictions issues to the forefront of public consciousness during the past year. Communities are grappling with these issues and turning to healthcare professionals for effective tools and solutions to address them. In response, primary care teams have devised creative approaches to mental health issues and the opioid crisis that they hope to share with colleagues throughout Ontario and elsewhere.
Hi, my name is Bhavna and I'm a psychotherapist at the West Durham Family Health Team. I'm really excited and proud to submit this nomination for the Bright Lights Award for the work that we've done with condensed cognitive behavior therapy and dialectical behavior therapy groups. Thank you.
West Durham Fit created a condensed version of its CBT group designed to correct for the high attrition rates in its longer program. The first 10 groups combined had the attrition rate drop from 50% to 12.2%. The program is open to anyone interested in learning coping strategies and filled a gap in patient care. As a result, the team now offers a dialectical behavior therapy group. Tattle Creek Fit joined forces with St. Michael's Hospital to create the de-prescribing of benzodiazepines and Z-Drugs QI initiative. Providers received specific clinical tools, and patients were given team-based and clinician support to assist them in tapering their use. To help patients living with common mental illnesses navigate distressing emotions, Mount Sinai Academic Fit introduced an emotion-focused mindfulness group. Patients keep journals, meditate, share meditation experiences, and learn to approach life with passion, tolerance, and curiosity. They learn to deal better with shame and self-criticism more effectively. Credit Valley Family Health Team introduced an effort to identify patients with chronic non-cancer pain who might be at risk for opioid abuse. By adopting risk mitigation strategies, the goal is to create a balance between opioid harm reduction and adequate pain control. Village Fit undertook an approach to reduce COPD hospitalization rates for patients with serious mental illnesses. Almost all COPD patients also had mental illnesses and addictions, complicated by low literacy rates, little control over their living situations, and difficulties attending appointments. The team took a quality improvement approach, purchasing a spirometer, training staff to read it, and engaging the services of a certified respiratory educator. Children with mental health issues and learning disabilities are getting a helping hand from Couchiching Family Health Team. Their Social ACEs program, delivered in partnership with Toronto's Child Development Institute, is the only program of its kind in the region. The group program teaches transferable social skills that the youth can apply in other social settings. Center for Family Medicine Fit is working to extend team-based care to other family health organizations. Their physicians can access dedicated clinical therapists for patients who need only individual short-term therapy. The program's success has led to the launch of a dialectical behavior therapy group this fall. Temagami and Great Northern Fits have taken advantage of their mental health workers' personal trainer credentials to introduce a new foam roller program aimed at chronic pain management. At the end of the first 6-week program, 45% of patients required less pain medication, while 75% reported better moods. There was also a decrease in severity of pain and an increase in physical activity. Burlington and Caroline Fits implemented the Caroline Families First Wraparound program in collaboration with the Halton Reach Out Center for Kids. The program provides a family-centered approach to children and youth with complex mental health problems. It helps to bridge the gap between primary care and community mental health care using a multidisciplinary team. A pilot project conducted by Dufferin Area Fit to introduce a more patient-centered mental health intake process, improved intake times, and other aspects of service. They redirected staff resources to create a mental health intake therapist position, assigned a dedicated phone number, and encouraged self-directed referrals. The team uses a respectful, collaborative intake approach. Addiction advocacy and cutting-edge treatment approaches are hallmarks of St. Joseph's Urban Fit, thanks to the work of Dr. Anita Shrivastava, an acknowledged expert in the field. She was integral to writing Canada's National Opioid Guidelines. Her protocols made St. Joseph's the first hospital in North America to offer frontline opioid addiction treatment in its emergency department. In partnership, Niagara Region's Emergency Services, Welland McMaster Fit launched a mental health and addictions reduction team to reduce emergency department visits and improve patient outcomes. The team includes a part-time dedicated mental health and addictions nurse. With the nurse's help, the team is able to triage calls and redirect patients to services better suited to their needs. Guelph and East Wellington family health teams joined forces with the eHealth Center of Excellence to form an eHealth think tank, whose opioid toolbar is a groundbreaking initiative. Created in collaboration with TELUS, it provides decision support for safe tapering of opioids using an individualized approach based on best practices. It focuses on patients with non-cancer pain. Health for All Fit created a safe opioid prescribing initiative that also features an ENR toolbar. The toolbar focuses on patient and provider safety in opioid prescribing and use. The initiative aimed to increase patient understanding of risks, benefits, and safe use of opioids. It also sought to increase provider capacity for safe prescribing. To assist with the challenge of providing timely access to mental health care, Women's College Academic Fit leveraged existing resources by applying advanced access principles to its interprofessional staff in a novel way. With more than 20,000 patients and only 2 social workers, the team's creativity allowed for a 50% reduction in average wait times for social workers. Clearing the existing waiting list and adhering to the 6 to 8 session model made a difference. In addition, urgent cases are seen within 1 to 2 weeks. Making life with chronic pain easier is the goal of McMaster Fit's pain management program. In addition to patient education, the program incorporates the skills of a physiotherapist and an occupational therapist to optimize their functioning. The team offers a lifestyle management group and an exercise group free to the rostered population. There were so many excellent entries to this awards category, but a volunteer panel selected a program that involved stakeholders at multiple levels and provided opportunities for peer leaders. The program that captured their attention is the collaboration between Halton's Reach Out for Kids and Burlington and Caroline Fits. Their Caroline Families First program for children and youth with complex mental health issues uses an evidence-based wraparound model. It uses a peer support worker who is co-located with referring physicians to create a circle of care. Its care coordinators and family support providers help families build capacity for coping with their youngster and navigating the healthcare system. Please give a warm round of applause to the Caroline Families First Wraparound program for its award-winning effort.